Hey everyone, welcome back to the another episode of the Physio Guy podcast, where we talk about everything related to physiotherapy, rehabilitation, and how your body truly works. I'm your host Anand, and today's episode is something special. We are diving into a topic connected to your thoughts, emotions, and physical health: the mind-body connection in physiotherapy. You have probably heard people say things like stress gives me neck pain or I carry tension in my shoulders. Well, guess what? That's not just a saying. It's real, measurable effects of how your mind and body communicate. First, we will understand the mind body connection. Your mind and body are not two separate systems, they constantly influence each other through the nervous system, hormones, and muscle response. When you are stressed, your brain releases chemicals like adrenaline and cortisol. These increases your heart rate, tighten your muscle, and prepare your body for flight or fight response. If the stress continues every day, like sitting in tension or working, worrying, or lack of rest, your muscle remains tight, especially around your neck, shoulder, and back. This leads to muscle stiffness, headaches, poor posture, and sometimes chronic pain without any visible injuries. That's where physiotherapy plays a huge role, not just treating the symptoms, but in breaking the stress pain cycle. We will talk about the physiotherapy approach. In physiotherapy, when we recognize that a patient pain is linked to mental or emotional stress, our treatment becomes more holistic. We use a three-step approach. First, relaxation and muscle release. We begin by releasing physical tension in the muscles caused by stress. That is manual therapy. Gentle, soft tissue release for neck, shoulder, and upper back helps relieve tightness. Heat therapy. Applying hot pack to the neck shoulder area increases blood flow and reduces muscle guarding. Electrotherapy, that is TENS or IFT, reduces pain perception by stimulating nerves and relaxing muscles. After the pain subsides slightly, we move to step 2, mind calming and breathing technique. Now we focus on calming the mind because pain perception is strongly linked to the mental state. We teach mindfulness and controlled breathing, which physiotherapists often integrate into rehab sessions. Here is few simple exercises I often recommend. Diaphragmatic breathing. Sit or lie down comfortably. Place your one hand on the chest and another on the abdomen. Inhale deeply through your nose. Feel your belly rise and not your chest. Keep your chest stable. Exhale slowly through your mouth. Repeat this process for 5 to 10 minutes daily. This will reduce your heart rate, lower cortisol, and relaxes the entire body. Progressive muscle relaxation. Start from your feet and muscle upward. Tighten each muscle group for 5 seconds and then release it completely. Notice the difference between tension and relaxation. This is a great for patients with fibromyalgia, chronic tension, or anxiety related pain. Then box breathing. This is used in sports physiotherapy too. Inhale for 4 seconds, hold for 4 seconds, exhale for 4 seconds, hold for 4 seconds. Improve focus and reduce the anxiety during rehabilitation. Now, corrective and strengthening exercises. Once the body and mind are calmer, we introduce gentle movement to restore muscle balance. Here are some effective physiotherapy based exercises that supports both physical and mental well-being. First, cat cow stretches. Get on all fours, that is both your hands and feet. Inhale as you arch your back, cow pose, and exhale as you round your spine, cat pose. Encourage spinal flexibility and helps release stored tension. Chin tuck exercises. Sit straight, pull your chin slightly backward like making a double chin. Hold for 5 seconds and relax, then repeat. And this exercise should be repeated 10 times. This also releases the tight neck from the neck muscles and you will feel relaxed. Shoulder blade squeeze. Sit or stand straight, gently squeeze shoulder blades together. Hold for 5 seconds, repeat for 10 to 15 times. Then pelvic tilt. Lie on your back and with knee bent, gently flatten your lower back and then release. It will relieve your lower back tension and increase awareness of your core stability. Walking meditation. Walk slowly, focus on your breathing and the movement of each step. The exercise combined physical activity and mindfulness reduces stress and improve your posture. Now I will share with you a real life example of a case that I have treated. I once treated a 35-year-old office worker who had severe neck and shoulder pain. He already had done X-ray and MRI. Everything was normal, but he was under immense job stress and spent a lot of hours at the computer. So instead of only focusing on neck muscle, we started with breathing training, mindful stretching, and then few postural correction exercises. Within 3 weeks, his pain reduces to 70%, not because of any special medicine, but because we treated both his body and his mind. So here are some key takeaways from this episode. Your mind and body are always connected. Stress, anxiety, and emotional pressure can physically show up as a pain or stiffness. Physiotherapy doesn't only treat muscles, it restores balance between body and mind. Simple breathing and relaxation techniques can be just as powerful as strengthening exercises. That's it for today's episode of the Physio Guy podcast. If you found this episode helpful, don't forget to share it with your someone who is always stressed or suffering from body pain that never seems to go away. If you are watching this on YouTube, hit that like, subscribe, and comment below what topic you would like me to next cover. Maybe posture correction, stress management, or sports rehab. Until next time, keep moving, keep breathing, and take care of your body, your mind. And thank you for listening to this podcast. Bye bye.